Good morning. Okay, it's a very crisp and quite dismal Sunday morning here. So I'm on break at the moment. The last week has been quite interesting. We've had more COVID patients. So quite varied symptoms, not the typical main symptoms of temperature, shortness of breath, and taste buds. These symptoms have been more like arms, legs, well mostly legs pain, or feeling like you've had an exercise but you've not done the exercise. So it sounds like it could be that it could be connected to the kidneys, I don't know, but a lot of people have aches and pains around their hips and their legs. Feeling of utter exhaustion is another symptom which a lot of these COVID patients are getting. So yes, they've got these three main ones, but there's also then underneath that you've got the secondary symptoms as well, and we're seeing a lot of those, which is quite interesting really. So we've taken in a few people this week, only because they were just quite poorly. But most of our COVID people we've kept at home because their O2 levels are at a point where they're not desaturating when we are trying to do their 40-step test. So we look on JAWCalc, and there's loads of guidelines on JAWCalc which we have to follow. And if they follow a certain criteria, we can then do what's called a 40-step test, whereby we check what their O2 levels is before the test, and then we'll plug in the connect their O2 to their fingers and ask them to do 40 steps, and after that it's then just to see if they desaturate or not. So when that happens, we kind of think, okay, well, is it desaturating to the point where it's really quite difficult for them to breathe? Is it dangerous? Sometimes they even stay at home under conditions of, stay home, but if you start feeling worse, then obviously call us back. But we try and keep as many as we can at home, because the less people in hospital with COVID, the better. So that was interesting. Had a lady yesterday, it was quite a funny one really, where she had a mobile wheelchair, and she was in this electrical mobile wheelchair, and she was completely off legs, so she had to be hoisted here, there and everywhere. Lovely lady, sort of in her 80s, something like that, and we came in and we found her sat in a wheelchair with her daughter next to her, laughing. I thought, okay, well at least she's breathing. She's all right in that sense. And the story was that she's just got this mobile wheelchair. She's had it since November, but she's very rarely used it because she's not a very good driver. And she thought this time, she has it like maybe once a week, she has a go at it. It's a really nice one. It's like, very plush, very soft seats, and the mechanics of it is very easy to use. But yesterday she had it on low setting, which is actually still quite fast really, and she misjudged the door frame of her lounge door and bashed her foot onto the door frame. So as you know, toes can be quite painful if you catch them in the wrong area. This lady also has some diabetes as well, conditions, so anything to do with the feet is quite important that gets checked out anyway. So I went in there and there was a towel over her foot with quite a lot of blood in there. I thought, oh crikey, what's she done to her toe? So apprehensively I lift up the towel, and between her two little toe and the next toe, in the crevices there as it were, she had done quite a big laceration to between the toes, to the point where it's still bleeding, and a lot of skin tears on the other one. And I said, oh, can you feel your foot? You know, does it hurt? She said, oh no, it's fine. It's been dead for years. I think, oh crikey. So she's got no pain there, thankfully. There's no necrosis, or it wasn't going black or anything, but it's just that she hasn't got that feeling in that foot anyway. Because I think there's some other spinal problems she had originally. But she didn't know she did it. And it was funny because I was just doing some things to tick off for direct pressure, indirect pressure, for bleeding and wound care, and I just happened the next one was to do with wounds. I thought, oh, I could tick that one off today. So this is things that you have to do as an ECA, and also going on to the paramedics, being a student. I think you've got to tick off bits and pieces to say that you're confident, and they've given you evidence that you've done something. But I'll have another video on that later on. But yeah, so I've used a couple of gauzes and some sodium chloride water to clean it out. Looked at my what's it called, using the light to make sure that I can look really well into the wound, and I thought, you know what, it probably could do with a stitch, or at very least it could do with gluing up. So we called the SP, which is a specialist paramedic, and they're really good because they can come out and they can do suturing and they can do gluing and that sort of thing and keep people at home. Sadly, he was on, or she, whoever it was on call for another patient at the time. So we put this lady to the hospital, you know, which is quite interesting, and we had to use a hoist, and my paramedic I was with had already worked with care homes, and she knew how to handle the hoist, and the daughter was also helping as well. So I have no idea how to use the hoist, so I kept way out of that. And you should only use it if you know how to do it and if you get permission to do it. So anyway, we hoisted her onto the stretcher into the ambulance, and then the usual obs, and then on to hospital. But that was quite a nice little sort of, not gory, but a little bit of blood doesn't really help. It doesn't hurt at all for doing this job. But yeah, it's been an interesting week. But yeah, quite a few COVIDs, a few falls, non-injury, some lovely patients. You know, haven't had a horrible one yet, so I'm sure that's going to be on the pipeline. Still loving the job. You know, wish I did it years and years ago, but there you go. Life gets in the way sometimes. Anyway, you take care and stay safe. Keep warm because it's supposed to be the first day of spring tomorrow in bulk, and hopefully we'll still see some daffodils and that come up soon. Okay, take care. Bye bye for now.